Good afternoon. I'm Jennifer Candolino, and thanks for joining us for our live webcast with Dr. Arun Gulani, a world-renowned eye surgeon and founder of the Gulani Vision Institute here in Jacksonville. Today we're going to be talking about surgical options available to you if you want to toss out your reading glasses or bifocals. Dr. Gulani, thanks for being here with us today.
A pleasure, Jennifer.
You know, according to the National Eye Institute, when many people hit 40, they start experiencing some blurred vision and difficulty focusing in on things close up, for example, maybe with sewing or reading a newspaper or being on the computer. It's a condition called presbyopia, or presbyopia, however you want to pronounce it. And I'm particularly interested in this because now that I have hit 40, I've started kind of doing the, you know, the little focusing thing. Yes. Explain why this happens.
Well, if you look at presbyopia, basically, if you look at your eye as a model, you have your lens in the eye. You're born with an absolutely clear lens, and this lens stays in this position in the eye and helps the vision. Now, this lens actually also zooms inside the eye, very much like a camera, tele-wide. That helps you see distance and near at the same time. Now, when that tele-wide stops or decreases because the muscles go weak with age and time, that's when you have to zoom with your arms. So that condition is called presbyopia, actually age-related change in the vision characteristics of the eye.
So you get your arm workout muscles because your eye muscles are weakening. Yes. Now, you have just returned after teaching at the American Academy of Ophthalmology conference held in Chicago, and you shared your advanced laser surgeries with colleagues from all over the world. And now next month you're going to be investigating future technologies for presbyopia while teaching in Europe. You're all over the place sharing all of your wonderful knowledge. If you're not wearing glasses, and that's one way to treat presbyopia, what if you don't want to wear them? What are your other options?
So glasses and contacts are always the first option, but they may not give you the full range that you want. Now, if you don't want glasses, the other option is vision corrective surgery. So what you can do in these cases is I'd like to split them into two basic categories. Patients who are not cataract age group, meaning the younger age group of patients who are wearing reading glasses or who need reading glasses, and the age group of patients who are cataracts at this point and need cataract surgery. And we'll explain in a moment why this differentiation is so important. So if you're in an age group which is just hitting 40 or just barely there and now feeling the need for reading glasses, cannot see things up close, then they can have advanced laser vision surgery like an advanced Lasik. If they were wearing monovision with contacts or glasses before, you can actually simulate the monovision with the advanced Lasik surgery. If not, you can do blend Lasik surgery, which is the new trend of vision corrective procedures. And you can do that, and actually we have a patient here today, and you can see distance and near without glasses. So that's the procedure I use a lot for patients who are in a younger age group who are not yet having a cataract but who are frustrated with this need for reading glasses.
Okay. You mentioned the monovision and the blend. How do you decipher? I suppose it is depending on age, which surgery you do?
Yes, one, and also their past history. Let's say a patient comes to me saying, "Doctor, I've worn these contacts or glasses with monovision for X amount of years, and that's how I've gotten away with my presbyopia. Can you help me? I don't want to wear glasses and contacts." He says, "Sure." The fact that you wore monovision and you were happy with it, meaning you have proved to me that that works for you, and that's a function of the brain. So I'm going to simulate or replicate that scenario by using advanced Lasik surgery for you.
Okay. And I know we have one of your patients here. We actually have two of your patients. Valerie, if you want to come over and join us. Now, did you do the monovision or the blend?
For her, we did a monovision concept, and actually we did only one eye. That's another advantage for patients who didn't wear glasses at all and then suddenly hit a time and age in their life where it's frustrating because they were always perfect vision for distance.
Right.
And that's what we did for Valerie. We did surgery on one of her eyes with the laser and gave her the blend mono concept. So she is not only deprived, she's not deprived by one and other eye. She can actually see great 20/20 distance and 20/20 up close.
Valerie, thanks for being here.
You're welcome.
And sharing your experience with us. Go ahead and start with, before you went to go see Dr. Gulani, what were you experiencing and why did you need to call attention to it to get some help?
The typical things that started where you can't read the magazine or whatever that you've been looking at, the newspaper, contracts, everything got harder and harder to read. Kept going up in the reading glasses, and it just really wasn't an option for me to have glasses or contacts. I'm 46 years old. I live here in Jacksonville. I'm in the ocean. I love to swim. I teach a jazzercise class. I work off an iPod. I couldn't see when the music would stop on my iPod for some unknown reason where to restart my music again. And
yeah,
so it was very frustrating. My children would be upset because I wouldn't text them back because I couldn't see the cell phone. And it just kept getting worse and worse. And did a little research and came up with my hero here, Dr. Gulani. And I've been so happy.
What was the process for you once you went to go visit Dr. Galani? Once that daily experience of not being able to focus easily became too invasive that you needed to get...
Well, I did a little research before I went to go see him, and I've seen write-ups of him in the Jacksonville Magazine and also in Forbes. And when I went to meet him, he also made sure that I knew all my options and I understood the procedure. So, I mean, the options pretty much were nothing, glasses, contacts, or try the Lasix. And I was just so sick of the glasses that I knew the Lasix was what I wanted to do.
And Dr. Galani, I'll bring you in at this point. How did you evaluate Valerie and decide what was the right surgery for her?
So the way I do it for every patient, and Valerie, you included as you know me, is I look at vision corrective surgery as an art, never as a cookie cutter. I'm totally against many, many practices where they just decide, okay, we do one or two techniques, let's put patients into it. Wrong. You evaluate the patient thinking, here's Valerie, here's her condition, here's what she has. She sees great with one eye, she's actually 20/20 distance. How do we make her read? She's very active, very dynamic person who likes distance and near vision all the time. And look at her age and her future. And you come up with a plan, of course looking at the ocular anatomy and the other things we do with advanced diagnostics. And I came up with the decision that in her mind and her capacity to see, along with her brain, if you may, to fuse, we would do a blend monovision surgery for her. And that's what exactly worked the way we wanted to do.
Okay, now Valerie, back to you. What was your experience after the surgery? Tell me about the surgery and what you experienced for those who are viewing and are interested in listening to your story and saying, that's me, I need to go get help from Dr. Galani.
I thought it would be more, but it really was a very quick procedure. I know it's probably more than 30 seconds, but it seemed like the actual procedure was maybe 30 seconds. I was up and in the next room. My husband had brought me that day to have the surgery. They handed me the instructions to go home with, and I have this habit, because I haven't been able to see it, automatically taking that paper and handing it to my husband because I can't read it anyway. Right. And I was like, wait, and I grabbed it back and I was like, I can read these directions. I mean, that was right after the surgery, and I could read it right then. They're like, we don't want you to read, we want you to wait a couple days and rest. But even getting in the car that day, there were so many dials and gadgets on the car that I had never used because I couldn't see them.
It was like a world that had disappeared to you for a couple of years,
right? Because before you would have had to pull the readers out every time you wanted to see any of these items. You can't wear the glasses and drive, and it just changed everything.
So I guess, the difference that you noticed was immediately, even though you recommend taking it easy for a little bit of pain.
It is surgery. In every surgery, you must recommend, taking rest, letting the eye heal. But the beauty is, and the fact is, like Valerie just said, yes, in those few seconds, the shaping of the cornea is done. So obviously the rays of light are more focused at that point.
And you mentioned that you look at laser vision, the surgery, as an art. Everybody is different.
Yes.
You hear that in life every day. You can't treat two people alike because everybody has different personalities. And again, with their eyesight, it's an art that you have definitely fine-tuned. Well, thank you so much for joining us. Your life today is back to normal then, right?
Good, yes.
And you text your children. All right, thank you, Valerie. Now, we talk about Valerie being at an age where blend surgery is probably the best option with the monovision. But we have other candidates for other types of surgeries to get the same results. And while you're answering a question, Barbara, why don't you come on in? For patients with cataracts, you offer a multifocal lens, and the implant clears up the cloudy vision, but it also restores the eye's ability to zoom. And I guess that's unique because many cataract patients have to wear glasses after cataract surgery, right?
Correct. Yes. So first, let's understand what we discussed on one of our previous shows. What is a cataract? So with age and time, this natural lens, which is crystal clear that we are born with, turns into a cloudy lens, and that's called a cataract. Now, because this was a lens to begin with, you obviously need to replace it with a lens. So it's replaced by an artificial lens in the eye. Now, when this artificial lens, instead of being a simple lens, is a special lens that has a progressive rings in the center that make you read like progressive glasses. These are called multifocal lenses. When you put such a lens in, not only does it correct the cataract for its clarity, it also helps you see the distance with that specific power, and also read with the central zones. That gives patients the freedom from glasses today in the cataract age group. So that's why I said in the start of this show, when people need these after 40 glasses, if they are not cataractous and young, you do the surgeries like we did on Valerie. If they are into the zone where they need cataract surgery, you take advantage of that scenario because they need surgery anyways. Put this specific lens in, and they see the whole world, distance and near. And Barbara actually is representative of that scenario.
Barbara, thanks for joining us and being here to share your story. Can you tell us about what you experienced before you went to go see Dr. Gulani?
Exactly the same thing. I couldn't read, could not read. I couldn't without glasses. And I had gone through the progression of cheaters to the strongest one. And I was monovision for years, one contact lens and one not for reading. And I couldn't, a grocery store, or clothing store, you have to ask somebody, what's the price on this tag? And I'm a realtor, so I have to read contracts, write contracts, read appraisals, are very difficult to read. And it was, if you didn't have the glasses around, you were just out of luck. So I actually was referred to Dr. Galani by a friend, and because I'd talked to many doctors and been told there's nothing you can do for presbyopia. That's, but he did his evaluations, said yes, I was developing cataracts, and that he could fix the. I went to him so I could read, not worrying about seeing, and it's been amazing. It's been an amazing freedom.
So you were actually told there was nothing that can be done about presbyopia. Is that what you're finding, that people are hearing that outside of what you're able to offer?
Absolutely. I mean, think about it. I've just said this on the national stage too, Jennifer. Presbyopia, in fact, is more prevalent than even nearsightedness and farsightedness. That is the biggest population of patients and the most frustrated because many of them never wore glasses before. So it's not like they were conditioned in childhood that, oh, we have to wear glasses. It hits them hard at the 40, 50 years of age. They're like, what happened here?
Right.
One. Two, absolutely, it's been told repeatedly that, no, this cannot be corrected. But again, if you look at it as a cookie-cutter concept, the answer is no. But if you look at it as an art, well, what else is going on with her? All right, she has a cataract. Let's remove the cataract, put a special lens in. Patients who've had previous cataract surgery, you can do advanced blend Lasik on top of them. So you see, there are no limits. If people are very nearsighted, you can put in a contact lens inside the eye, permanent, and bring that into monovision. You can do Lasik on a 35-year-old and prepare for the presbyopia so they don't get it until 60.
Wow.
So there are no limits when you look at it as an art.
Yeah, it's an endless array of options that you have.
Absolutely.
Exactly. Yeah. That's amazing, though, that so many people are being told that there's nothing you can do about it and that you just need to
I even feel cataract surgery has been revolutionized with this technology of lenses today, where, remember, cataract surgery, you have to put in a lens anyways, right? Because the cataract was a lens to begin with. But with these lens technologies available today where they can make you see distance and near, I think it's revolutionized cataract outcomes to a whole new level.
Yeah, it sounds like it. Barbara can attest to that.
Definitely.
Now, tell me what you found when you diagnosed Barbara and what you were able to analyze with her prior surgery.
With Barbara, we have advanced technologies available in our institute where you can even pick up cataracts earlier than just a doctor looking at you through a microscope. That's called cataract densitometry. So when I looked at her eyes, we said, sure, we can do a laser technique because she had monovision experience. But we picked up early cataracts. So then the logic is, Barbara, it makes more sense that you go this way to the cataract and get it done forever rather than go through laser and then have cataract next year.
Right.
So then we decided, let's go the cataract route. We went through the cataract route one eye at a time, 1 week apart. Lasik, you do both eyes same time.
Okay.
So we did cataract with the special lens, and that's pretty much it.
So you would have been in to visit him or eventually anyway.
Exactly.
And so you were able to take care of both with one visit. And now explain your experience. Was it the same as Valerie's right immediately after the surgery?
Immediate, yes. After the 2 weeks of the cataract surgery to take care of that issue, then in for laser, and it was, again, it seemed like we were in there 10 minutes, if that. And it
you don't
was
hear
immediate.
that very often, do you?
It was painless, and now I can read that paper almost in your lap.
Probably better than I can. That it's
Exactly.
in my lap. I may need to make a visit too soon.
Yes, I had gotten the extended arm syndrome too.
Excellent.
Yes.
a good way to work out the biceps, but you need some help with the eyes. Well, thank you so much for being a part of our show
My
here.
pleasure.
What is life like for you today? I mean, it's almost probably
It's
like a
freedom.
whole new world.
It's totally freedom. Now people ask me what time is it, and same thing with it. Everything's digital. Everything's on our palms these days, and so you can read it, I can text it, I can tweet it, I can do anything. And I can't say enough about Dr. Galani, and he goes through it meticulously, explaining exactly what your options are, what you're going to go through. I brought my husband with me, make sure I heard everything, and it was just the thing for me, and I would recommend it to anybody.
Well, the smile on your face and Valerie's face says it all, and I know when we walked in today they called themselves the Gulani girls, so I think you've got a fan club going.
I'm indebted to my patients because I love the fact that they share that same passion of educating others. To me, there's nothing higher than this because vision changes lives. And to artistically put everybody into their best visual capacity, I believe is every doctor's responsibility. Not to leave vision on the table. Go for it.
Well, it's not only what you're able to offer your patients, but the experience as well. As we heard, the before, during, and after. It's a complete package that you offer your patients. Thanks again, Barbara, for being a part of this. Let's talk a little bit more about the difference between multifocal lenses like Restore, Resume, and Crystal lens, and how do you decide which lens to use? Because there's a lot of options in that front as well.
Absolutely. So again, the options you can divide into anatomical, optical, and technology.
Okay.
Okay? So
Sounds
it's simple.
Exactly.
So anatomical means what? What kind of eye does the person have? Is it a short-sighted eye? Is it a far-sighted eye? Is it an eye with astigmatism? Does the eye have some abnormality? Is there scars, some dystrophies, diseases? 2, we talked anatomy. Let's talk about optics. Are those people very nearsighted, very farsighted? Because the eye may be too small, too big. Is there enough space? 3, we talked technology. So different companies have come out with different kinds of lenses that help distance and near. There are 2 basic kinds of lenses. One which are called multifocal, meaning they have the zones on them. And 2 are the lens that moves, like our own natural lens used to. These are called accommodative, or they move in the eye, like they zoom. So different names by different companies, but the concept has to be the doctor has to be originally a good Lasik refractive surgeon and combine that knowledge with cataract surgery. Because if you think about it, Jennifer, you may do a great cataract surgery, which is inside here, but if you don't know how to do Lasik on this cornea, you left the camera half done.
Right. There's a lot of things that come into play.
Exactly. Again, think of it as a camera. You can't just buy a very expensive lens and have a scratched viewfinder. So the way I like to look at this is anatomy, technology, and optics. How can I best make this eye see so this patient gets a full potential? And all these lenses are based on those calculations of which eye deserves the best.
So when you're analyzing a patient or doing the diagnostics on them, any of the 3 could come into play because of whatever their particular needs are.
Yes, and also remember you can combine LASIK with cataract surgery too. So let's say you have cataracts and you are very farsighted or you cannot read, and you have astigmatism, which means your cornea is football shaped. I will first do your cataract, put in a lens that can give you distance and near. A month later I'll do LASIK on your cornea to correct that football to a basketball. You are done.
Again, when Barbara and Valerie were sharing their stories, and they're all smiles because of what you were able to do for them, you are talking about your eyes, and even though you struggle with things, sometimes it's easier just not to do anything about it than to take what people would call a risk in having a surgery. For those who are watching today and are saying, oh, I don't know, it's a risky thing when you say, the S word, surgery.
Sure.
What risks are involved? It doesn't seem like much, really.
Sure. So the risk is as much as any normal cataract surgery or normal LASIK surgery. Cataract surgery is the most common done medical procedure in the world. By using these lenses, the risk is not increasing. Now, these lenses each have their own pros and cons, but that's where the patient selection becomes so important. You don't just use one lens because that's all you know. You select the best lens for that patient and also plan if you need to do LASIK a month later, so the whole camera is working. So I like to answer these questions in a more logical fashion. If you have selected the best technology for them, understanding their anatomy and optics, then you have designed the best surgery for them, the chance of complication is extremely low. If you're just hoping for the best by putting in something, then you have a problem. So if you work like that in any scenario, whether it's LASIK or cataract, the chance of complications is extremely low. Chance of success is tremendously high. Because again, the surgery was customized for that eye.
Right. And in this instance, for sure, it seems like the benefits far outweigh any risks that are involved. What do you see about the future for these types of surgery options? I know you're so involved with education as well, and learning and research. Where's the future in this?
The future in this is, I believe cataract surgery, which I've already used abroad in Germany actually in June while I was teaching at the World Conference, is we can use lasers now to do cataracts. So no need to go to the OR to surgical center and do the surgery with ultrasound. Laser does the entire cataract surgery. You inject a lens rather than having a lens made of acrylate. And that will also accommodate, because it's a gel, the way we were born. And that will take care of presbyopia, nearsightedness, farsightedness, and next day you can bring them to the office and with a laser modify the power of the lens that you put in yesterday to perfection.
Right.
Depending on their profession. That is, I believe, the future, which I've already looked at. Now, other lenses I'm going to investigate in Europe next month are lenses that also have photocell, meaning like your glasses, you go out in sunlight, it gets dark.
Okay. Yeah,
So
that sounds...
lots of amazing stuff going on.
When you were, I know we were just talking about you being at the American Academy of Ophthalmology conference in Chicago. You know, what's facing the industry these days? What sort of questions were pointed at you in terms of your advances and the entire industry as a whole?
Well, these are exciting times. I mean, the fact that all these things are available for patients today is tremendously exciting. I think it's a payback to the industry that has spent years in research to reach this level today, that a cataract patient actually expects to see distance and near. A Lasik patient expects to see in an hour. Excuse me, you can take patients off previous cataract. Let's say someone has had cataract surgery, had an ordinary lens. They're not stuck. You can, with a laser, bring them back to this level of vision. So very exciting times today. And patients are trying their level best to go for these available options, because this is for the rest of their life. So the choice is very important too.
And like you said, I mean, eyesight is just so important to everybody. When we're talking about our viewers at home saying, gosh, I'm going through the same thing and experience the same thing, at what point do most of your patients come in to seek help? Is it initially, you know, like somebody like myself, who I have started doing doing the arm, but it's not to the point where it's become invasive in my life. At what point do you recommend somebody coming to see? Because maybe, as in Barbara's case, there was a little bit of early intervention involved.
Yes. So it depends on your profession, how much it's affecting you, and whether the doctor caught it first. Now, let's say you come in for a routine visit, and the doctor finds, oh, you have cataracts. Oh, doc, that's correct. That's why my nighttime I see a lot of glare and my colors have decreased. Okay, that's the problem going on. Second, you may, because of their profession, I do a lot of surgeons and doctors, they find it much earlier because they can't operate that well. Or, you know, someone's a pilot, or in the Navy SEAL or a SWAT team, they would be affected much faster because their acuity is in high demand, right? They will notice immediately that they cannot do their job. And of course, if the patient notices that this is affecting my lifestyle, you know, I cannot, like Valerie said, I couldn't wear the glasses, or like Barbara said, you know, it was being difficult and others couldn't fix it. Well, there was a reason that couldn't be fixed. There was a cataract brewing inside the eye.
Right, right.
That's how you come to a conclusion, when to intervene. And of course, educate the patient. In Barbara's case, I also remember I encourage all my patients to bring their family. Like she mentioned, her husband had come in, he's an attorney. We discussed Q&A. Make sure everybody understands, because these concepts are logical.
Right. Well, it's so important to fill yourself with knowledge before you make any step to do anything. We talk about, or earlier we mentioned that it wasn't something that you can prevent. There really is no way to train your eye to not lose its muscle, I guess, elasticity or strength.
There are many theories on this. We actually, to be honest, the reason for presbyopia is still not known that well. There are still 2 or 3 theories kind of combating whether it's the weakness of the muscle or the hardness of the lens. Okay. But the concept still is you can make that work with the movement of the lens and the corneal shape. Yeah. So preventable cataracts also, we don't know how to prevent them because these are age-related. Sunlight does play a factor. Genetics is important too.
Again, I guess that falls into the research aspect of what you're trying to study, coming up with new answers and then, again, new solutions for people who are experiencing problems. Now, I know we touched on this, combining Lasik and cataract surgery to help people see without reading glasses. Are you seeing more and more of that, patients like Barbara?
A lot, in fact. Patients who had previous Lasik surgery or before Lasik, there was a surgery called radial keratotomy, or RK, you know, for taking away glasses. All those patients today are coming in for cataracts, or if they've had ordinary cataract surgery, they want to know, hey, I missed the boat. Can I get back? Can I have the new technology? Absolutely. They can be upgraded to that technology with laser or lens exchange.
Now, you mentioned when you were heading to Europe, which you'll be heading in the near future, you'll be looking at the different kinds of lenses and options. What else will you be experiencing while you're over there?
Well, besides teaching, I'll be conducting courses and things on what I do here, right here in Jacksonville. Another important course I'm doing this year is for them is how to manage complications, or how to, give this whole spectrum of care, if you may. Most surgeons are pretty good with one or two techniques, but how to open up their mind to think bigger. So the patient gets what's best tailored for them, not just a one and two thing that they're restricted to. That is going to be very important when I talk and teach.
When you go to other places, whether they're around the country or around the world, where do you find they are I know you are cutting edge. I mean, you are a leader, world-renowned, as we mentioned at the top of the show, and as everybody who follows you knows. Where do you find the rest of the industry is compared to where you are?
Difficult to say, Jennifer, because each place is different. I do believe in this, though. Every doctor strives to give the best they can to their patients, so that you have to give it to them. Absolutely. I haven't seen any doctor who does not want to do the best they can. Mm-hmm. But there are limitations, whether it's technological, whether it's the learning curve, or whether it's the desire to constantly take it to the next level. So that is where we have to inject the passion. Once that happens, then the rest will fall in place.
You mentioned that you are an artist, or you consider yourself an artist, because that's how you have to look at it, because an eye is a delicate thing, and you need to work with it within all of the options that you said you have. Would you say that's a key, really? I mean, to look at your job as something like that and not just getting in there and doing a surgery? I mean, it's the mindset, I think, that you have that makes you unique.
Well, I would say that doesn't even need an answer. I mean, it's exciting. To me, this is not work. It's exciting that I have the privilege of being a doctor to help people see. And my commitment to my patients is I'll do everything possible to get them there.
Now, you've had a lot of success with this program and with patients like Valerie and Barbara who are walking away just ranting and singing your praises. You want to give back to your patients and offer something exciting. Why don't you share that with our viewers?
Absolutely. What we are doing is, for these holidays, is we are giving away a gift of vision surgery through our institute, and as me as a surgeon. And we are asking that you send us your video. It's a 1-minute video. All this information is on the Channel 4 website. Submit your video explaining why you or your loved one deserves this laser vision or vision corrective surgery. And it's my pleasure to do that, to see someone deserving get that this year in the holidays.
All right. Well, you talk about your passion. That's evident, and we wish you the best of luck with your trip to Europe and continued success with your practice. Thanks so much for being with us today.
My pleasure. Absolutely.
Take care. Well, that is all the time we have for today. If you have any questions about the different vision corrective surgeries we talked about, you have eye issues that you want answers to, or if you want to find out if you're a candidate for LASIK eye surgery, email us at askdrgalani@wjxt.com. or you can get in touch with Dr. Gulani directly. His information is up on our screen right here. And our next live webcast will be December 20th, and we're going to announce the winner for the Gift of Sight LASIK Eye Surgery Contest, which you can find out more about by going to the contest page on news4jax.com. And we're also going to discuss future technologies for LASIK and cataract surgery. And we'll see you then. Thanks for joining us.